Hi, this is Janine Forsberg from Lakewood, Colorado, and I have been a nurse now for about 20 years. I started out in SICU, the Surgical Intensive Care Unit, and then from there I went to the emergency department. So for about 18 years now I've been basically involved in emergency services. The last 10 to 12 years I've been in leadership, so I haven't been at the bedside. For 2 years now, I've been the Director of Emergency Services at St. Joseph's Hospital in downtown Denver. And we see about 58,000 patients a year. Our acuity, like the studies, like our readings have said, more chronic illnesses with all the baby boomers is really been reflected in the patients that we've been taking care of in the emergency department. So I've been here 2 years, and then the previous 6 years I was the Director of Emergency Services at Salina Regional Health Center in Salina, Kansas, USA, Center of the Universe. But I moved out here to be closer to my children and grandchildren. I'm excited about this class. I started out intentionally 20 years ago in getting my associate's degree because I in no way, shape, or form wanted to be a charge nurse or in any kind of leadership position. And then I think because I was so much older than everybody, they kind of shoved me into leadership. But little by little, I've taken more leadership roles. And so I got my bachelor's here at St. Mary's, and now I'm working on my master's, and I'm really enjoying it. This class, I think, is going to be a great introduction into delivery care models for patients. And it's so interesting to read that, you know, as here we are in the United States, and we're such a civilized nation, and yet we don't have a universal coverage that's run by the government. And I think, you know, as Americans, we're kind of leery of the government running anything, and so that's probably been a lot of the resistance. But I'm interested to learn about the new care models in healthcare delivery. We use in the emergency department a patient-focused care model in taking care of our patients. The challenges I anticipate are time. The night before last I was called in because we went on divert, and so I worked my normal 12 hours, and then I went home and went to bed for 2 hours, and then I was called in and worked from midnight to 6 in the morning, and so then I lost the next day by sleeping. So you know, work and the whirlwind of life and sometimes kind of interferes, and so and we never know. Being downtown, there's lots of raves and different, whatever those things are called, for, you know, techno concerts and stuff. And so we have a lot of people that come in with drug overdoses and just overloads the system. And then if another fellow hospital goes on divert, then we'll get ambulances back to back to back with 2 to 3 passengers, you know, patients at a time. So that's my biggest challenge, is making sure that I've got the time, and so I'm really challenging myself to work ahead this time and get caught up. And I'm going to start on that paper come heck or high water, so I don't have to worry about that at the last part. It's nice to see some familiar faces, and it's nice to meet some new faces. And Dr. Atkinson Smith, Atkinson was my maiden name, so perhaps we're related some way. But anyhow, happy 4th of July, and I look forward to this class and learning more about the Affordable Care Act, and also the different delivery care models. So thanks. Bye-bye.